and healthcare as we know it is changing.
Yeah, thanks in part to last week's Better Health Conference at the Connecticut Convention Center. Maggie, you have all the details.
I do. So 2018 marked the 5th year for the Better Health Conference, sponsored by Cigna, an event that brings together healthcare practitioners to discuss topics like innovative trends, suicide prevention, and the doctor-patient relationship.
Today we're at the Better Health Conference.
At New England's premier patient engagement event, attendees had the opportunity to connect with vendors showcasing state-of-the-art consumer healthcare innovation.
We often have a mix of people who come. We have providers, we have lots of consumers or patients who come. We sometimes have people like me, we're state agency people.
The Better Health Conference was presented by Connecticut Partners for Health, a coalition of organizations and agencies from across the state who have one goal in mind:
to get patients engaged in their health care and to get them healthier.
The Better Health Conference was hosted by News 8 anchor and medical reporter Jocelyn Mementa.
He is today truly the best-known spokesman for the patient engagement movement.
And featured speakers like Dave DeBronkart and his personal physician, Dr. Danny Sands.
In January 2007, I discovered I was almost dead from stage 4 kidney cancer. You know, my average expected life was 24 weeks, just 5.5 months. I was really sick.
But rather than take a back seat to his care, Dave decided to be as involved as possible.
And ultimately, that saved my life.
After beating cancer, Dave became known as ePatient Dave, the E standing initially for electronic because of the role the internet played in his treatment.
Now it means empowered, engaged, equipped, enabled.
Dave and Dr. Sands advocate for something called participatory medicine.
We need to stop thinking about healthcare as a car wash, in which patients are the cars and they're dirty or unhealthy and they're passing passively through this healthcare system and getting health sprinkled on them and somehow coming out the other side healthy. We need to think about healthcare more as a collaboration.
Some people think that in the speeches I give that I'm saying everyone should be like me or they're bad and wrong. That's not what I say. What I do say is the medical profession, if they encounter somebody like me who wants to help, we should welcome it.
Changing healthcare one person at a time.
So empowering there, huh?
Yeah, and by the way, ePatient Dave is now running 5Ks, and he started running later in life, so he's made a remarkable recovery.